How's it? I'm still talking about the BI test. This is probably part 7 now of the big process advisory videos that I'm giving you. Okay, so yeah, the BI test, I was mentioning which textbook and which website to go to study the theory part. Now, let me explain how the theory test looks. It'll be on a computer and it'll be multiple choice. So don't worry about having to write down all sorts of sentences for answers on a test. The the test is compiled of, I think, if I can remember correctly, 100 or no, sorry, 50 to 70 questions, and you need to pass 60% of those questions to pass that section of the theory test. Okay. It's all randomized on a laptop. You're going to sit down. You will probably have for other fellow nurses from other parts of the world next to you also trying to do the test. And your test is randomized and different compared to the person next to you. They have different questions. You have different questions. So that's also a method of cheat proof. On the StudyVisor website that I recommended to you, there are practice tests. Focus on those. They really helped. Okay. It's not to say that they ask exactly the same questions. They might just ask it in a similar, sorry, I just had dinner, in a similar context, but it's still like general knowledge. And a lot of those questions are on this textbook that I mentioned earlier and on the study guide website. So focus on those for the theory. For the practical, this one's a bit tricky because they go according to protocols on a certain website called the VLANs protocol. I need to actually quickly write that down for you. VLANs protocol. Now, when I was a when I was a versorgende IG, I had access to this website. And then when I resigned so that I could start finding a nurse position, a proper verpleegkundige position, I couldn't access this website anymore. Luckily, I did download the practicals to learn for. It's basically like an OSCE. So I have a list in my head as to what they are. They are different types of injections: IV, IM, subcutaneous, Lodrecht's technique, and pinch technique, different types of subcutaneous methods of injecting. Then you're going to get also nasogastric tube insertion, catheter insertion, indwelling catheter, and single-use catheter. So there's 2 types to choose from: eenmalig of inblijver. For male and female. Okay. Yeah, so those are the basics as well. Let me just think now. There's also a medication calculation. That is very important. So I can guarantee you are going to get a medication calculation. All right. Whether it's tablets, IV, or IM. And then you must calculate the medication as in the formula: what is ordered divided by what's in stock times 1 equals how many mils. That if you study that medication calculation, then you'll be fine. And then you will also get either a catheter, a nasogastric tube, practical OSCE, one of those. You'll definitely get one of the injection OSCEs because it's in relation to the medication calculation part of the practical. My advice to you, as I've always done in our previous OSCEs as nurses, was to pretend that the examinator is a student and you are teaching that person how to do a specific procedure. I don't have access to the VLANs protocols anymore, but you can try look them up on YouTube somewhere, or even on the internet, as in saying Netherlands. Let me think now. Netherlands skills, practical skills as a nurse, like catheter insertion in the Netherlands, nasogastric tube insertion in the Netherlands. I actually need to find that link that I found on YouTube. It was very helpful. I'll just have to mention it in my next video because I can't really stop this one. But yeah, that is part of your practicals. Now, for the clinical reasoning, you need this pocketbook, Proactive Nursing Sakboekje by Mark Bakker. Yeah. This helps you to learn. You don't have to memorize this entire book, but it does help to know where everything is, so bookmark it. There's all sorts of algorithms that you need to learn and acronyms that the Netherlands has. Health and disability, functioning, mental. Then there's blood results. What are the normal blood results and how to read a blood gas, the signs of septic shock. It's a whole pocketbook of information that you can go through and highlight. You can look at different ECGs, and those are just some crypt notes. And then, yeah, the different hemodynamic systems. So cardiac, pulmonary, neurology, kidneys, everything. You know how in ICU or in nurse theory, we always talk about like ARDS, CVAs, heart attacks, head to toe assessments. This pocketbook helps you to recognize all those patterns. Now, the nice thing is that during your clinical reasoning scenarios, you can take this inside. Well, that's what I could do. I could do it. I don't know if every exam center allows it, but hopefully you can take it inside, because you can refer back to it to look at what's normal, what's not normal, vital signs, etc. And there is a page in here that is definitely important to use. It's called the Early Warning Scale, or the score, the Modified Early Warning Score, the MEWS. Here's a little laminated card that I've gotten from a colleague. It's also in here. It's like, how's your breathing pattern, your pulse, your systolic blood pressure, your neurological conscious state level of consciousness, your temperature, and your urine production. It's a whole table that you can go assess your patient based on the scenario that you are given and what's normal and what's not. With the clinical reasoning, you are given a scenario in Dutch. You must answer in Dutch and discuss with your moderators in Dutch. For instance, they give you a patient who has a hip replacement and isn't responding to pain medication, is irritable, and has a fast heart rate and a high temperature. You can say that the patient and the urine production is less than 5 mils or less than 0.5 mils per hour. And you calculate it and you go according to this. Okay, fast heart rate, low level of consciousness, etc., etc. Septic shock or hypovolemic shock. That's what you kind of expected to do. I'll explain further in the next video.